Probably the two biggest words in medicine right now are minimally invasive. Those are surgical procedures that use special instruments and create less trauma. Joining us right now is Dr. Moshe Perez of Boca Raton Regional Hospital to tell us much more. First of all, doctor, thank you for joining us.
Thank you for having me.
Okay, I'm going to try to pronounce these next two words correctly. Gynecologic laparoscopy. Tell us about that, what it is and what it entails.
Gynecologic laparoscopy refers to placing a camera through the belly button to view the internal organs and to be able to perform abdominal operations.
Okay, and I'm glad I had you here to pronounce that second one. But anyway, how is this performed? You said through the belly button. Is there anything else people should know about that?
It's a fairly routine procedure which has been used for the last 30 years. Okay. And new instruments make the procedure easier to perform, and more complex procedure can be performed through the same approach. It certainly requires a fair amount of skill to be able to perform the procedure.
Of course. Let's talk benefits here. What is the benefits of this versus traditional methods of surgery?
It certainly involves a smaller number of incisions, typically one incision in the belly button and two further incisions in the pubic area.
Okay, okay. And how do you decide, you have a patient coming in, they're considering this, how do you decide this is the best type of procedure for a patient?
Generally speaking, quite a lot of procedure can be done laparoscopically, and laparoscopically really involves two sets of procedure can be done laparoscopically. One is robot-assisted laparoscopy, and the other one is conventional laparoscopy. Certainly in some patients who, for instance, have multiple uterine tumors, it becomes much more difficult to perform it laparoscopically as to conventional small incision and removing the fibroids that way, simply because of the fact that laparoscopic procedure is more complex and literally takes a longer period of time to perform.
Okay, after the performance, after this type of procedure, let's talk recovery time. Is this inpatient, outpatient procedure? What are we talking about here?
Generally speaking, laparoscopic surgery is an outpatient procedure, and the recovery time is much shorter than it would be for traditional surgery. And typically will take about a week, whereas with traditional surgery, it may take 4 to 6 weeks to recover.
Okay. You have to be a good patient for this, or a good candidate, I should say. Again, what should people know about before going into this type of procedure to be the best type of candidate for this type of procedure? Obviously, the good recovery time and quick recovery time is a very attractive method.
Right. I mean, you have to select the proper patient, the proper condition, and to make sure that the operation is done safely for the patient.
Okay. Well, doctor, we thank you for joining us. Very interesting stuff. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor segment. Recent studies have shown that taking a You know, we've all heard that moderate amounts of alcohol can help prevent heart disease, but is drinking really good for your health? Joining us now is Dr. Ignacio Valdez of Boca Raton.
Start drinking,
right?
Because you never know where that will lead.
Of course. Well, doctor, very interesting. Recent research has found that a widely used drug to treat type 2 diabetes may actually help to prevent cancer. Joining us now is Dr. Ignacio Valdez of Boca Raton Regional Hospital to tell us much more. First of all, doctor, thank you for joining us today.
Thank you. Thank you for having me.
Let's talk about this. This is interesting. What can you tell us about these findings?
Well, these findings are very interesting. Now, metformin, which is one of the preferred drugs for treating diabetes, has been around for quite a while, was found to reduce the risk of pancreatic cancer, but only in women, which was surprising. They did not show any reduction in men. But, however, they also found that sulfonylureas, which are the oldest drugs, oral drugs, medications for diabetes, actually increase the risk of pancreatic cancer in women. And insulin increased the risk of cancer in men.
Okay. When we're talking about, preventing cancer, can it also slow the growth of a tumor?
Yes. And now a different study actually showed that in men, it actually slowed prostate cancer.
Okay. Okay. And these are studies that have been out recently?
Recently, last week.
Wow. Okay. Very, very current. Can you tell us, we've talked about what type of cancer has been shown to prevent or slow, but just to reiterate that, the types of cancers we're talking about here.
It's mostly pancreatic cancer, but also a benefit in prostate cancer.
Okay. And do the results have any profound implications on all maturing individuals? I mean, what type of age groups are we talking about here?
Well, first of all, any diabetic, type 2 diabetic, who can be on metformin should be on metformin.
Okay.
So I don't, in my practice, it wouldn't implicate much because I strongly believe that they should all be on metformin.
Sure.
Now, will it, as far as non-diabetics, I think this data mostly encourages patients with a diagnosis of prostate cancer to start taking metformin even before they take the prostate out, if that's the course of action, because it will reduce the risk of growth.
Okay. Is there anything else you want to add to this? I mean, this is an interesting topic here. Type 2 diabetes, again, the medications we're primarily talking about, again, are? It's
metformin.
Metformin, okay.
As a positive effect, that it's reducing cancer, while sulfonylureas and insulin will raise risk of cancer. I think, well, insulin can stimulate cancer growth, and of course insulin works mostly in the pancreas. That's why the benefit of reducing pancreatic cancer. So I think it's huge because overall it's a great drug for diabetes, and now that it's generic, it's also very inexpensive.
All right. Bringing good news today, Doctor. We appreciate that. Thank you for joining us. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor segment. Coronary heart disease is the leading cause of death for men and women in the United States. It covers a range of conditions that affects the blood vessels going to and from the heart, from discomfort to life-threatening conditions like heart attack. Joining us now is Dr. Alexander Kulik of Boca Raton Regional Hospital to tell us much more. Doctor, first of all, thank you very much for being here today.
Thank you very much for having me.
Let's talk about coronary artery. The Christine E. Lynn Heart and Vascular Institute at Boca Raton Regional Hospital is the first in Palm Beach County to offer a new catheter system for cardiac patients that uses extreme cold. You heard me right. Dr. Martin Klosterman of Boca Raton Regional Hospital is here to tell us more about the so-called cryo balloon. Doctor, tell me about this.
If this should be handed over to prosecutors, defense attorneys say releasing the records would violate Zimmerman's privacy. The Hillsborough County Sheriff's Office is making space to house extra inmates during next week's Republican National Convention. The 1,700 inmates at the jail near downtown Tampa have been moved out to make room for what deputies will expect to be a busy week once the convention gets underway. The entire jail's been dismantled and transferred.